Hello, good afternoon. I'll be demonstrating the IV piggyback doses administration and calculation with my scheduled patient, Mr. Tutu. First of all, for the sake of the discussion, I've divided into several categories. Like first of all, the introduction collection of my materials and equipments. Then I'll be calculating the drug dose. Then I'll be stating the drug dose. Then I'll be documenting the drug, the whatever my job was. So first of all, I'll show what equipments we got for this presentation. I'll start with this hand hygiene hand rub, my sterile gloves, a pen, my patient's list here, Mr. Tutu's drug chart. Now Mr. Tutu's wristband ID, the NG cat, 5cc syringe, my watch to adjust the doses, the original medication written here, dimenhydrinol, 50 ml, and with the expiry date, my alcohol swab, my blunt needle for the medication here, my secondary set, the 50 milliliter sodium chloride solution, normal solid solution, and the patient label. And first and foremost, the code track where you see the prime line already with normal saline. It's all 0.9% normal saline is hanging here, and the rate has been already primed as 17 drops per minute. And I'm using this biohazard bag to collect all my garbage, and there's a sharp container just to put my things out. So first of all, I'm assessing, I'll just to adjust the thing so that you can see. So now I'll start with my patient chart. This is going to be my first check. So here I see the actual order. Mr. Tutu is being allergic to dust and pollens. And I'm assessing Mr. Tutu's medical history and also Mr. Tutu's MAR chart where his vital signs are mentioned here. He's all pulmonary and other gastrointestinal, renal, all medical histories there. I'm just reviewing his medical chart and everything looks pretty much fine. Dr. Smith already administered, advised him to take the medication. He's also on insulin. And now we have to give him this dimenhydrinol 25 milligram, 50 ml normal saline IV PRN for his nausea and vomiting. So first of all, first and foremost, I'll think before we go to the bedside of Mr. Tutu, I'm going to calculate the dose. So the order says to give 25 milligram in 50 ml normal saline. So 50 ml normal saline is 50 milligram is 1 milliliter. So 25 milligram will be in 0.5 milliliters, half cc or half milliliter medication in real life. Now I'm calculating the correct infusion rate because infusion rate is so important for the medication. 50 ml in 20 drip rate comes to be 25 drops per minute. So after rounding, it comes to be, it comes 6, as you see here, that I'm just using the calculator, comes to be 6.25. So in real life, I'm going to round it for 6 drop per 15 second, which I'll be showing later on. And the infusion rate already adjusted 100 ml per hour. Then I'll assess the IV compatibility of the client, the IV side for this reason. I've chosen his left cephalic vein. So I'll be assessing and the site appears okay. There is no redness or any other infection site. Now after that, I'm going to prepare the medication. So this is, before medication, I'll take a hand hygiene because this is very aseptically thing. As you see, I've already prepared my drip sheet, draw sheet very nicely. It's kind of aseptic environment. I have to make sure that there's no chance of infection comes up. Now I'm going to second check. This is my second check with MAR Gravel dimenhydrinate. The trade name is Gravel and his generic name is dimenhydrinate. That's my second check. Now I'm taking a hand hygiene. I have to check the medication to be compatible with the secondary MAC. So in the normal saline now, I'll take my gloves because this has to be very sterile. So I'm just putting on my gloves now. Now, as you see, I'll take this CC syringe out, my blunt needle also. and just keep blend little. And I'm also taking the alcohol swab prepared, just taking it out so that it will be in, comes handy. Now I'm just scooping the end of this with my needle. I'll just holding the other side, and while I'm holding this, I'm just uncapping the medication. Is written here dimenhydrinate gravel 50 ml, and expiry date is 10th March to 2030. So it's good until now. So that's my third check. Now I have to take the 0.5 ml as I calculated. So I just open it. Now with the alcohol swab, I'm just cleaning the tip of the medication. Now with my non-dominant hand, I'm holding my medication, and I'm just taking some 0.5 ml air right inside the center of the medication. I'm putting it. Now I'm taking out 0.5 ml gravel, making sure that there is no air bubble. Okay. As you see, I've taken 0.5 ml normal saline gravel medication on my 5cc syringe. Ideally, we should have taken 3cc syringe, but there is no supply for that. So with that, I'm going to prepare it. Now I'm going to take this alcohol swab and this 50 ml normal saline. I'm just cleansing the tip of the medication port just to administer this medication in the center. With my dominant hand, I'm just pressing all the way down, pressing whole of the medication, and make sure that it's going to sharp container. I'm just putting on the sharp container now, and I'm holding on to my alcohol swab. And now I'm also putting my labeling it with my pen. Yeah, it's written here. Patient Mr. Tutu, drug dibenhydrinate, amount 25 milligram, 0.5 ml. I hope you can see. Added by my initial base solution is normal saline, and today's date 4th November. Start time 1600 ml and 1600 hours, and flow rate is 25 drops per minute. But for I'll show you how I'm going to adjust. Now I'm going to put on the back of the solution. Just this way. Here. Now we are all putting them on garbage in my biohazard solution. Now I'm going to gently agitate this way, so that the medication mix around. And I'm also checking the same thing here. That's my third check. Like I said, my patient Mr. Tutu, drug dimenhydrinate gravel 50 ml, and the amount is 25 milligram, 0.5 ml, and my initial with the base solution normal saline, and the flow rate adjusted 25 drops per minute. Okay, so after agitation, I think that's prepared now. Now let's open. I'll just keep it here for now, and that's fine. Now let's open the secondary set. Here's my secondary set. I want to show you. That's my extension hook that I have to keep it here now for now, because we have to put it on the gravel. And let's see. I'm just checking for that one. Everything appears fine. Yes, there's the port. So, and there's the part is spiky part. So I'm going to put this blue part, this spiky part. But before that, we have to make sure that, yeah. Now, with all aseptic precaution, I'm just slowly putting this inside and all the way towards my this coat rack, which I'm using as a saline stand. I hope you can see. Let me fix. Yeah. Okay. Okay. can see now I'm to adjust the rate. This is so important because we are not going to make a hurry and it's not not in a higher rate. So it should be at least the lowest possible rate for him as per his pay, and it's, as we say, we already calculated it to be 6 drops per 15 seconds. So I'll show you how. For now, just making sure the drip chamber is working. There's no bubble. Okay. Now the clamps, I put the clamps, roller clamps off. It's not running now, but before that I have to adjust. But before that I have to connect my port. So, but before connection of the port, I have to make sure that is also aseptically clean. And I'm going to clamp, make the port with this primed needle, and I'm going to clean it again with the alcohol swab. Here, now I'm connecting the two ports. I hope you can see. Oops. Yeah, we have to make sure there's no leak also. And yeah, it's nicely connected. This is my alcohol swab. I'm putting it back here. Maybe we'll discard it. We'll discard it soon after. Now we have to adjust the rate. For that reason, I'm using the extension hook now, just to make sure that this saline is lower than primary saline is lower than the grab, like secondary said, because this medication should be running now, and we'll adjust the prime line later on. And now I'm taking my clock. This is a lovely clock. I'm going to adjust the rate. It should be 25 drops per minute. So I'm going to adjust. One, two, six. 6.25, so we are rounded to 6. So I just wanted to show you also. And now we can open the clamp. Yeah, I just wanted to show you the flow rate because I don't have anyone to support me. I have to carry the whole video to you. I hope you can see from here. Let's just approximating as much as possible here. So I make sure it's 6 drop per 15 seconds. Okay. And already, like I said, this is my fourth. We already did the fourth check. Everything medications is running on. So now I'm going to check with my patient, Mr. Tutu. Hello, Mr. Tutu. How are you doing? I hope everything's fine. You have any pain? No? Okay, you're great. Okay, please let me know if you have any pain, or I will check it out. And since we already checked with your ID, patient ID, everything's fine. So let us know. And now I'll be documenting. Now I'm taking off my gloves. I'll be documenting in my MAR chart. Okay. The type of the treatment, rate of infusion, location of the site, like I mentioned, left cephalic vein. Mr. Tutu has having no pain and he is tolerating the procedure well. And now I'll be disposing all my supplies into the biohazard bag, including my gloves, and sharp containers goes to the sharp. So now I'm following up after 10-15 minutes over. Now I'm going to check Mr. Tutu again. Hi, Mr. Tutu, how are you doing? Okay, no pain. Okay, I'm really glad. There's no site is looking good, no redness, no swelling. So following administration of the treatment, when the was finished, I'll close the clamp on the secondary set. Let's say has finished. Now I'm going to close the secondary rate. Secondary floor. I'm going to discard the line. I'm going to take away the before that I have to take the gloves on again. Yeah, because we are handling the port, we have to be mindful about the thing. Hi, Mr. Tutu. Let me know if you have any pain or anything else. We'll be coming here again, and also the call bell is close by. Just press us if you have any pain or any problems, any issues. We'll be right back to check you. Now I am going to close the second bag, and I'm going to disconnect the port. With aseptically use the gloves. We are going to use the gloves again for sure, because we don't want any infection or any other thing. And we are going to discard this, and we are readjusting this prime tube back to its original drop, that is 17 drops per minute. So, and I'm going to remove the extension hook also, because since my medication is over now, I'm putting it back on the position and also adjusting the rate, what is 17 drops per minute. Okay, and we will be going to be around 6 drops per 15 seconds. I'm just adjusting with my watch here. Just to be 6 seconds. I can show you. Because of the coronavirus, I don't have anyone to help me. So I just want to drag my computer and skip as much as possible to show my prime line. So you can see it's already adjusted to be 17 drops per minute. Okay. And the port is already back there. I have to put the port also again, since we have done with the port. So we are no longer doing we are tapping the port here. Okay. Now Mr. Tutu is doing. Hi Mr. Tutu, how are you doing today? Great. You don't have any pain. I see your sight is also looking normal. There is no redness, and everything is appears to be fine. So I'll be documenting my procedure again, and I'm showing you the drug chart. Although there's some oral medications here, we already checked that. And for the IV, I put today's date, my initials, the drug is dimenhydrinate, 50 ml normal saline in 20 minutes. I put my initial. It's an IV with the secondary line. The frequency is for every 4 hour PRN for nausea and vomiting. And we'll be stopping. I put a date tomorrow, like 3rd of November. And that's my name, Syed Tanvir Ahmed, registered nurse, and my initial. Thank you so much for your patience here.